Hello friends, welcome to my new video about the very interesting reasoning questions of the respiratory system. And the questions are like that: asthma attacks are more common early in the morning. Why? And exercise that triggers the bronchoconstriction. How? So let us start. Headache is experienced while staying in an overcrowded room for a long time. Why? So due to increased level of the carbon dioxide accumulation in the room, thereby leading to oxygen depletion within the body, so that the headache is experienced while staying in an overcrowded room for long time. Now administration of the certain drugs by inhalation. So one of the function of the pulmonary circulation is drug absorption. So drugs that rapidly pass through the alveolar capillary barrier by diffusion rapidly enter the systemic circulation, so that these are administered by inhalation, like anesthetic gases and aerosol and other bronchodilators, so that the administration of the certain drugs by inhalation. Now, though the diaphragm is a skeletal muscle, why is it not fatigued? So, diaphragm, that is a dome-shaped seat of the muscle separating thorax and abdomen. Contraction of only a few muscle fibers causes the dome of the diaphragm to descend, so that at a time only a few muscle fibers in the diaphragm contract and other fibers are in resting condition, so that the diaphragm does not get fatigued. How the lungs slide easily on the chest wall. So the lungs that are enveloped by the pleura, which has two layers, parietal pleura and visceral pleura. Now in between the two layers there is a potential space that is known as parietal cavity, and this space is filled with a very small amount of the serous lubricating fluid, and that is known as pleural fluid, and which is dispersed throughout the pleural cavity. Now this fluid is adhesive and inexpansible and keeps the two pleura together. So therefore when one moves the other follows. So that is why the lungs slides easily on the chest wall but resist being pulled away from it in the same way, but the two moist pieces of glass slides on each other but resist separation. Now, asthma attacks are more common early in the morning. Why? So, the wall of the bronchi and bronchioles are innervated by autonomic nervous system by two division, parasympathetic and sympathetic division. Now, parasympathetic innervation through the vagus nerve. Now, whenever parasympathetic nerve stimulates, it causes a cholinergic discharge and producing bronchoconstriction and increased bronchial secretion via muscarinic receptors. And these nerves get stimulated by leukotrienes, irritants, chemicals, lead, carbon monoxide, hydrocarbons, and by cool air during winter or exercise. Now the bronchoconstriction that is caused by the cold air, that is not due to neural reflex as with other physical or chemical factors. Low temperature that acts directly on the smooth muscle to cause contraction, and there is a circadian rhythm in the bronchial tone with maximal constriction at 6 a.m. and maximum dilatation at 6 p.m. Now there is another supply, that is a sympathetic innervation, and that is through non-cholinergic and noradrenergic. Now this sympathetic stimulation that produces bronchodilation, and that is due to release of mediator vasoactive intestinal peptides. Now this vasoactive intestinal peptide has been shown to be deficient or absent in a large number of patients with bronchial asthma. So that because of all these reasons, asthma attacks are more common early in the morning. Now, pulmonary circulation acts as a filter. How? So, the particles filtered may include small fibrin or blood clots, fat cells, detached cancer cells, gas bubbles, and agglutinated RBCs, and mass of platelets or WBCs, and debris from the stored blood or intravenous solution, or these are removed by lytic enzyme in capillary endothelium and ingestion by macrophages and penetration into lymphatic system. So in this way the pulmonary circulation acts as a filter. Why no exchange of the gases is possible at the level of the conducting zone? So conducting zone in which there is a no alveoli are present. So conducting zone of the air passage is formed by first 16 generation of the passages, and it is only transport the gases from and to the exterior. So the conducting zone that starts from the trachea up to the terminal bronchioles. Since no exchange of the gases is possible here, so starting from the nose to the terminal bronchioles forms so-called dead space, and which has a total capacity of approximately 150 ml. So that in the conducting zone there is a no exchange of the gases is possible. Expiratory phase is longer than inspiratory phase of respiratory cycle. Why? So during expiration, bronchial constriction occurs, thereby resistance to airflow increases and more work has to be done, so that the expiratory phase is longer than the inspiratory phase of respiratory cycle. Bronchial asthma is a disease of expiratory obstruction. So during the inspiration, expansion of the bronchioles take place, but on expiration there is a constriction of already constricted bronchioles occurs, so that the bronchial asthma, that is a disease of expiratory obstruction. Left-sided heart failure leads to pulmonary edema. How? So when there is a left-sided heart failure, the blood begins to damp up in the left atrium, and this causes a rise of the pressure in the left atrium. Now initial rise of the pressure up to 7 mm of mercury has no effect on the pulmonary circulation, as this pressure that expands the pulmonary venules and capillaries. Now when the pressure rises more than 7 to 8 mm of mercury in the left atrium, it causes increase in the pulmonary capillary pressure, and that leads to pulmonary edema. So in this way, in left-sided heart failure, that leads to pulmonary edema. Now intrapleural pressure is always negative or subatmospheric. Why? So intrapleural pressure is negative or subatmospheric due to two opposing forces. First of all, the chest wall, that is normally partially pulled inwards, and it constantly tends to pop outwards. And the lungs have a constant tendency to collapse, means the recoil away from the chest wall. So the lungs are constantly tending to move inwards from their stretched position, and thoracic wall is tending to move outward from its compressed position. Now these two opposing forces tend to cause the enlargement of the fluid filled intrapleural space between them, but the fluid cannot expand the way air can, and so even this tiny enlargement of the intrapleural space drops the intrapleural pressure below the atmospheric pressure, and in this way the elastic recoil of both the lungs and the chest wall creates the subatmospheric or negative intrapleural pressure that keeps them from moving apart more than a tiny amount. So in this way the intrapleural pressure is always negative. Now lungs has tendency to recoil. So recoil tendency of the lung is due to elastic tissue in the lung is constantly stretched and it has a tendency to recoil. One third of the recoil tendency of the lung is due to this cause. Now second cause is the surface tension of the fluid lining the alveoli that tends to cause the collapse of each alveolar sac because it occurs in all the air sacs of the lung, and the net effect is to cause the lungs to recoil away from the chest. Surface tension force is responsible for two-thirds of the total recoil tendency of the lungs. So because of these two reasons, the lungs has tendency to recoil. Surfactant prevents the pulmonary edema. So, excess collection of the fluid in the alveoli and interstitial space surrounding the alveoli that leads to pulmonary edema. Now, surface tension, that is a retracting force which not only pulls the alveolar wall to the center of the alveolus but also pulls the fluid from the capillaries, which leads to pulmonary edema. With the reduction in the surface tension by the surfactant, the inward force that drawing fluid out of the capillary is reduced and therefore pulmonary edema is prevented. So in this way the surfactant prevents the pulmonary edema. Surfactant maintains the stability of the alveoli. How? So the presence of the surfactant that prevents the instability of the alveoli in the following manner or following way. So first of all, if the alveolus becomes larger in size, the surfactant molecules are scattered on the larger surface, and this causes a lesser reduction in surface tension, and therefore according to Laplace's law, that increases the tendency of the alveolus to collapse by causing a rise in the collapse pressure, and this opposes the effect of increase in the radius and prevents the change in the size of the alveolus and alveolar sac. Now if the alveolus becomes smaller in size, the surfactant molecules that form the thicker layer on the surface and cause the greater reduction in the surface tension, and therefore according to Laplace's law, the tendency of the alveolus to expand by causing reduction in the collapse pressure. So this opposes or neutralizes the effect caused by reduction in the radius and helps in maintaining the size of the alveolus or sac constant. So because of this, due to surfactant, stability of the alveoli is maintained. Airway resistance is high in conducting zone as compared to respiratory zone. So first of all, the airway resistance is affected by total cross-sectional area. So resistance to airflow is inversely related to total cross-sectional area of the respiratory passage. Therefore, the resistance to airflow is high in the conducting zone, whereas it is low in the respiratory zone. So that the airway resistance is high in conducting zone as compared to respiratory zone. Carter-Jenner syndrome is also associated with infertility in male. So, Carter-Jenner syndrome, that is associated with immotile cilia, and this is due to congenital absence of the axonal dynein, and this leads to recurrent lung infection, and patients with this condition are infertile due to lack of sperm motility. So that the Carter-Jenner syndrome is associated with infertility in male. So if there is any questions regarding these questions, so please write down in comment section and please give me a feedback about this lecture. So thank you very much.